and welcome to Health Q channel, the health awareness channel where our mission is to motivate you to look at the brighter side of your health. As usual guys, I'm your host, physiotherapist Meghana, and today with me is a very special guest. With us is Dr. Farmida Aman. So Dr. Farmida Aman has got 8 years of experience in ENT surgery. She is a master in surgery in ENT and she works at Apollo Clinic Bellandur. Her rich experience and the experience of writing and research paper on Bell's palsy makes her very unique in her skill set in managing Bell's palsy condition. So since you guys have a lot of queries related to Bell's palsy, I thought why not ask the questions to her because she is the expert in herself. So let's get started with today's show, ma'am. Welcome ma'am to the show.
Thanks a lot,
Thank you so much for sharing your feedbacks and giving your time, valuable time to us. So ma'am, our channel is mostly about awareness, especially for the people, the consumer of healthcare, and we try to raise awareness and motivate them. Basically, mostly what we have observed is people lack motivation when they go through certain problem, and Bell's palsy being such a sudden incident that comes into their life, they literally get shattered for some time. So we want to encourage them that just don't lose hope, and that's the reason we are doing this series of video. So ma'am, the first question that I would like to ask you is how you define Bell's palsy.
Bell's palsy is actually an acute onset of unilateral facial nerve palsy. Speaking in common language, it would be the paralysis of the facial nerve on one side of the face, which is sudden in onset. And it is more of a lower motor neuron type. That is, it does not involve the part of the facial nerve which is in the brain.
Right.
Speaking in a very, it does not involve the upper motor neuron.
Right.
Okay, so that is Bell's palsy, and it leads to deviation of the face, the mouth, angle of the mouth to the other side, because those muscles will be working more.
Correct.
Okay, there will be difficulty in closing the eyes, raising the eyebrows, or even ballooning out of the cheeks.
Right.
Okay, so that is what is Bell's palsy.
In your experience, how common is this problem, and who are more prone to develop Bell's palsy?
Bell's palsy is it's one of the commonest palsies that involve cranial nerves. What studies say, it is said to be around 60 to 75% of all cranial nerve palsies. Okay, so it's generally rare in children. I have not seen, at least in children. But yeah, it's common in elderly, even in middle-aged people, and then of course people who are immunocompromised, like diabetes. In pregnancy, we might see Bell's palsy.
So those kind of people are more at risk of developing Bell's palsy compared to kids and healthy adults.
Yeah.
So ma'am, when it comes to causes, like if you see the research side, it is called as a condition of exclusion. We need to exclude, and there is no known cause as such which can define Bell's palsy. Is that true, or there is any particular cause behind Bell's
what
palsy?
Studies say nowadays, it does have a viral etiology. Has been found. It has been found that it is the reactivation of herpes simplex virus, herpes zoster virus. Okay, but there are other causes also, because how does Bell's palsy occur? It's because of swelling that occurs in the fallopian canal, that is the bony canal in which the facial nerve lies, and it constricts the nerve. So that can be because of inflammatory causes also, and certain autoimmune causes also have been found. But of course, viral etiology is said to be common.
So mostly the cause is viral infection with herpes simplex virus. So ma'am, when a patient comes to you with Bell's palsy, what's the line of treatment that is usually followed?
When a patient comes, we have to first examine the patient properly, rule out whether it's an upper motor neuron facial paralysis or a lower motor neuron, and then examine him, take a proper history, and then when Bell's palsy is diagnosed, we have to grade the facial nerve according to the paralysis that it has. Okay, and following that, medical therapy will be the first line of treatment, that we all suggest. Medical treatment comprises of corticosteroids, which are given in a tapering dose, and antiviral is also given if there is evidence of viral infection. And along with that, we advise people to go for physiotherapy, facial exercises to strengthen the muscles, and of course eye care is very important in case of facial nerve palsy. We always prescribe eye drops, eye ointments to the patient, because corneal ulcers can occur because they will not be able to close their eyes.
Right, exactly. So many people just depend on the internet content and just go for the treatment. So it's very important that they should come, right?
Yeah, they should come to either a otolaryngologist or a neurologist and get treated for that.
Okay, ma'am. Mostly it is seen in studies like people recover from Bell's palsy in 3 months of duration. But there are many people who will have some, you can say, their Bell's palsy is not cured completely. What could be the reason behind incomplete recovery of Bell's palsy?
Incomplete recovery may be because there can be some other causes. The compression might have continued for a longer time. So viral etiology itself can go on for a longer time. Okay, so that can be the reasons for the Bell's palsy continuing for a longer time.
Okay. And is there any other condition apart from upper motor neuron Bell's palsy that can mimic Bell's palsy?
No, upper motor neuron, we won't call it Bell's palsy at all.
Right.
Okay. So there are other conditions like Guillain-Barré syndrome, in which there might be facial nerve palsy. But Bell's palsy, when we call it Bell's palsy, it has to be a lower motor neuron type of unilateral facial palsy. Of course, there are cases of bilateral, but then it should be unilateral and it should be lower motor neuron type.
Then only it would be called as
Bell's palsy.
Okay, so ma'am, now this question is particularly for the person who has got that chronic Bell's palsy, which has not recovered after taking medications or its conservative management. So what are the option of treatment that lies for that person, or what should
a person who has not recovered even after proper medical and physiotherapy, he should go for a surgical management. And the option that we otolaryngologists offer is facial nerve decompression. Okay, wherein the facial nerve is decompressed, there are different segments of the facial nerve from the labyrinthine mastoid and up to the stylomastoid foramen. So entire facial nerve, the peripheral facial nerve, is decompressed from the labyrinthine segment up to the stylomastoid foramen, where the bony covering of the facial nerve is removed, and the covering that the sheath of the nerve is slit open, so that the compression decreases.
So are there any risk factor associated with this, or it's you can say, because this is a question that comes from many people, this surgery is safe or not? So that's why
see, every surgery has its risk. Even this surgery has its risk, but in good hands, of course, in experienced hands, it does not. I mean, we have seen very less. Of course, the pitfalls can be that the facial nerve can be further damaged because we are opening the sheath over it. So facial nerve may be damaged further. And then some people may have unilateral hearing loss because of subluxation of there's a small bone called the stapes. Okay, if that subluxates, he may have a hearing loss. And there are other structures called lateral semicircular canal, superior semicircular canal nearby. They might get injured.
I have also seen in the comment section, ma'am, many people say we have got recurrent Bell's palsy. Twice or thrice.
Recurrence is possible.
So is it possible like every Bell's palsy?
No, every Bell's palsy we have not seen recurrence, but recurrence is possible. According to what the studies say, 4 to 14% can have recurrence. But recurrence is possible.
And what could be the reason for the recurrence? There is no common reason.
I can't tell you a reason for the recurrence. Can be a viral infection getting again happening in that patient. It can be that in autoimmune cases it might be recurring. But exactly telling you what is the cause of the recurrence
is very difficult.
Yeah,
it depends on individual. Coming to the pregnancy related Bell's palsy, ma'am, what a pregnant woman going through Bell's palsy, is it safe for her to go for a conventional treatment, or is there any other precautions?
No, we cannot give her corticosteroids if it's in the first 3 months. Definitely, ask her to go for physiotherapy.
Physiotherapy-based
Okay.
treatment.
Yeah. Later on, we always consult with a gynecologist.
Right.
If she allows, then we can go for a corticosteroid therapy for her.
Okay.
Generally, see, Bell's palsy also spontaneously recover in many patients.
Right.
So in pregnancy, of course, in the first 3 months, we cannot give
Okay.
corticosteroids.
And when it comes to kids, ma'am, there is a very small prevalence that Bell's palsy exists in kids as well. So, what is the etiology? It's again the viral infection that causes Bell's palsy in children?
Yeah, viral is supposed to be the common cause in children. Autoimmune can also be a cause in children. But of course, I have not encountered any children with Bell's palsy so far.
So, ma'am, thank you so much for sharing your valuable insight. It was very helpful, and I'm pretty sure that the viewers who are watching this video, they would also get a lot of understanding about this problem and a lot of clarity about this problem. If you have got any questions or queries, make sure you comment in the comment section below. I'll also put the link in the description if you want to consult to Dr. Farmida at Apollo Clinics, so that you can get further help from her. Thank you so much, ma'am. Thank you so much. It was a pleasure having you on this channel, and it was very much helpful. Hope you enjoyed with us.
Of course, I did.
Yeah.
Thank you so much.
Thank you so much, ma'am. Thank you. Bye-bye.